You want to educate patients about oral appliance therapy. They are brand new to this. Their pulmonologist never told them that oral appliance therapy could be an option for them, let alone an alternative to CPAP. So explain to them how oral appliance therapy works by advancing the mandible. I just use that word on purpose, mandible. Use a 5th grade level speaking when you are relaying this message to people. Do not say mandible. Say the word jaw. I only use that for your benefit so that I can explain how you should be speaking to patients in your messaging. Use language that they understand. Instead of saying advancing the mandible when explaining how treatment works, say moving the jaw forward. People understand what that means and they don't feel stupid when they're listening to you because they don't know what a particular word means. Very, very important. And then also just explain how the treatment process works. When they come into the office, what are they going to experience? When they go home for a sleep test, what does that process look like? What does coming back into the office for that delivery of the appliance look like? What's it going to feel like when they first wear the appliance for the first few weeks?